Well, this is the time of year when people with unsightly veins really want to love their legs, but instead they often hide behind long skirts and pants.
Yeah, getting rid of those sometimes bulging veins can be painful, but Dr. James Gariti is here with his patient, Ron Wessel, to talk about a much less invasive treatment. Thanks for being here, gentlemen.
Nice to have you on the show.
Yeah, let's start a little bit with vein disease, doctor, and just talk about how someone would know that they had vein disease and what some of the symptoms might be.
Sure, that's a great question. You know, vein disease is one of those things that unfortunately sometimes is hidden. People will have achy, tired legs and just assume that it must be old age. I hear a lot of, or I stand a lot.
Yeah.
They'll have cramps at night and assume they're dehydrated or not taking in enough potassium. Sometimes you can see the big bulgy veins, but a lot of times you can't, and really the only way to see them is to do an ultrasound to identify them.
What kind of symptoms were you having, Ron?
Mainly like the bulging veins and maybe some tingling, sensitive to touch and whatever, and just maybe tired legs.
Was it affecting your day-to-day activities?
Yes, I think so. Yeah, just you feel that you didn't have that much energy that you really could put forward on your on what you were doing, and it was maybe a time to have something else done to it to take care of that.
But I love what you said during the break. You kind of had these symptoms, but it wasn't you initially that thought, oh, I need to do something. Your wife urged you, didn't she?
Right. We saw the commercial on TV for vein clinics and went online and found the on Dr. Reedy's office and contacted him. And before you know, I was in to see him, and we had a consultation and went from there.
Yeah. No, years ago, 20 years ago, I think you said, you actually had the stripping procedure, which a lot of people had, especially if they had some type of treatment years ago, which can be really painful,
It was like you had time in the hospital after the surgery, and then you had like 6 weeks off with, you know, some real special things you had to kind of watch.
Compressions,
yeah, just right,
stockings.
exactly right. And that was the same thing for both legs, and but the symptoms came back.
Oh, it just makes me cringe thinking of the word vein stripping. I mean, and what you do, Dr. Gariti, is totally different. It's a different procedure, less invasive. How is it different than vein stripping, and why would someone use it for a similar problem?
Sure. The way that we would do a vein stripping is you would make some incisions or cuts in the skin. You would try to grab onto the vein and pull it out through those cuts. And there's a similar procedure called a phlebectomy where you do a similar thing on some of the twisty branches. So basically with those, you're trying to grab onto and pull out the vein, and it just like it sounds, it's pretty traumatic and pretty painful. Instead of those procedures, we do laser procedures and we do injections. So no cuts, and after any of the procedures that we do, you're back to normal activities from day one. You can exercise. I always tell folks, you know, the things that we do, we're poking you with needles. It doesn't feel good. It's not a massage, I always tell folks. But by the same token, again, most people, Tylenol maybe a little ice, it's usually very, very tolerable, and again, back to normal activities.
Now, in Ron's case, he had the stripping and the symptoms came back. When you do the more minimally invasive treatments, are the symptoms less likely to come back with that versus the stripping?
Sure. I always tell folks when we do a surgical procedure, you can only get out the veins that are big enough to grab onto and pull out, which means you leave a lot of them behind. With the injections, you can actually get all the way down to the smallest little vein that you can imagine. So I think we do a much more comprehensive job. But by the same token, vein disease is a genetic disorder. It is a disease. So oftentimes veins can come back, and we usually keep track of people's legs over time.
Okay.
How about insurance? Because I think a lot of people, even if they're having symptoms, they're afraid of being able to cover the costs associated with treatment.
Sure. Most insurances provide some level of coverage for vein treatments. Every insurance policy will have its own little rules and hoops and whatnot. So typically what we'll do is when a patient comes in, we'll have them talk with our office manager. She'll have gone through things with their insurances and figure out what those hoops are so that we understand what's going to be covered, what isn't going to be covered, and we go from there.
All right, now Ron, everybody's dying to know. You had the stripping done. Now you've had the more minimally invasive procedures. How do they compare?
Oh, no comparison. I mean, just from the standpoint of having the procedure done from Dr. Gariti's office and being able to, you know, just leave the office and continue normal activity, and and actually from November when we started to now, fast, and you can see just the progression of how things were
feel better in shorts.
Better. Oh, yeah, absolutely.
And your bathing
suit.
Yeah,
my wife said my legs look good. Again.
That's so cute.
Well, I think it's great. Yeah, you can put on the shorts, you can go golfing, you can go out and do some yard work and feel good about them.
Right.
And I bet you just feel better in general.
Oh, definitely. Yeah, exactly, for sure. And you know, it's like the first time they all came back. This time, I'm sure the way doctor proceeds. should be great. It should last a lot longer.
I bet that makes you feel good. That people not only feel better physically, but that they have more confidence wearing shorts or having people see their legs.
Yeah, there's no question. I have a number of patients who come back and for years hadn't worn shorts, didn't want to wear sandals, a variety of other things that they might have felt or seen, and it's very, very gratifying.
That's awesome. I like hearing that. Okay, so you have a Listen to Your Legs seminar coming up, which is a great opportunity for people to find out more about these more minimally invasive procedures and less downtime, which is fantastic. The one that you have coming up is Thursday, July 25th from 6:30 until 8 p.m. Again, it's called Listen to Your Legs, and you can find the Vein Clinics of America. They're on South Executive Drive in Brookfield. To make an appointment or to get more information, you can call 866-618-8346 or go to veinclinics.com. And is the seminar that you have free?
It's a free seminar. It's going to be a unique seminar. We're actually going to do an endovenous laser procedure on a patient live and have it sort of video transmitted into the waiting room so patients can see what it all looks and feels like and have the patient come out and answer questions before and after.
That's awesome.
So that hopefully people will have a realistic idea of what it all is about.
Yeah, live demonstration.
Yeah. Limited seating, that's the only thing. So
RSVP.
Please call. Okay. So we have enough seats.
Fantastic. Thanks both
Ron.
of you.
Thanks, Doctor.
Thank you.